Today's Diabetes Matters is presented by Nancy Liu, with a brief opening presentation by Lydia Girmay. Nancy is a registered dietitian, and Lydia is a registered nurse with Washington Health.
This presentation is on diabetes and heart health by Lydia Girmay and Nancy Liu. We'll be talking about diabetes and heart health and nutrition for heart health. So we'll be talking about what is cholesterol, types of fats, importance of fiber in your diet, sodium content of foods, and label reading. So what are some risk factors according to the American Heart Association that cannot be changed? Some risk factors that cannot be changed are increasing age, male gender, and hereditary, including race. Some risk factors that can be changed are tobacco, smoke, and vaping, high blood cholesterol, high blood pressure, physical inactivity, obesity and being overweight, and diabetes. Some other factors to consider that can also be changed are stress levels, sleep patterns, alcohol consumption, and diet and nutrition. So what are the ABCs of diabetes? How do we manage our diabetes? So the A stands for A1C. So this is a blood glucose test that you can get at a lab every 3 months, and it's basically a summary of your last 3 months' blood sugars. So the goal for patients with diabetes is to be below 7%. The B stands for blood pressure, and the goal for our patients is to be below 130/80. The C stands for cholesterol levels for LDL, or our bad cholesterol. So the goal for our LDL is to be below 70. So what are some sources of cholesterol? We can get cholesterol from our liver and also from the food that we eat. So what happens over time when we have an excess level of that LDL cholesterol that we mentioned earlier, or that bad cholesterol? So over time, when we have high levels of that LDL cholesterol, it can eventually lead up to a buildup of plaque in our arteries. So what happens when plaque builds up? It can narrow the arteries and harden the arteries. So that helps increase the risk for heart attack, stroke, and other cardiovascular events. So maintaining our LDL levels within safe limits helps reduce the likelihood of these events. So what are some general goals for our cholesterol levels? For our HDL, or what we'll call our good cholesterol, the goal is to be above 45, so the higher the better. For our LDL, the goal is to be below 55 for patients with heart disease, below 70 for high-risk patients or patients with diabetes, and below 100 for everyone else. For triglycerides, the goal is to be below 150. And for total cholesterol, the goal is to be between 100 and 199. So what are some medications that we can take to help our cholesterol? So prior to starting lipid lowering or cholesterol lowering medications, a lipid panel should be obtained. So statins are known to be the first choice for primary and secondary prevention. Some common statin medications are atorvastatin, rosuvastatin, simvastatin, pravastatin, and lovastatin. If unable to meet LDL goals with statins, you can use additional therapies such as ezetimibe, bempedoic acid, and PCSK9I. ACE inhibitors are also used as a first-line treatment for patients with high blood pressure. For our patients with diabetes, SGLT2 inhibitors can help lower blood sugar by helping excrete it through the urine and preventing excess fluid from building up around the body, which also helps reduce the risk for heart failure. So this is a little picture to kind of show how LDL and HDL works in your bloodstream. So LDL goes around your body to help provide cholesterol all over your body. And HDL Well, kind of think of like cholesterol scavengers. So they'll go around your body, around your bloodstream, and collect that excess cholesterol that the LDL drops off to help transport it to the liver so the liver can help get rid of it from the body.
Hi everyone, my name is Nancy. I'm one of the outpatient diabetes dietitians here at Washington Hospital. Now I'm going to talk over about different foods that can affect your heart health. So first, we're going to talk about the different types of fats and how they affect your cholesterol. So first we have trans fats here. These ones, they increase your total cholesterol and they also decrease your HDL, the good cholesterol. So we'll talk about what examples of these ones are. The second type of fat we'll talk about is saturated fats. These ones tend to increase your total cholesterol as well as your LDL, the bad cholesterol. And then the third one we're going to talk about is the unsaturated fats. So these ones, they can help to improve your good cholesterol count. Overall message is that you want to replace your saturated fat intake with the unsaturated fats. Okay, so first, the trans fats. So they were invented as an alternative to saturated fat by turning vegetable oils into semi-solid fats, such as shortening. And they allowed for the processed foods they were used in to remain fresh for a longer period of time. But the FDA has found that to be actually more dangerous than using saturated fat for your heart health. So since the 2006, FDA has ruled that they must be declared on a nutrition label, but they used to be found in many types of prepared foods like cookies, crackers, even some frozen breakfast foods. But try to assume that these foods tend to contain trans fats unless labeled otherwise. And you can also look inside the ingredient part of the nutrition label. And if it has anything that says partially hydrogenated or hydrogenated oils, then these are what the trans fat is. So even if it says 0 grams on the nutrition facts itself, if it's less than half a gram of trans fat total, it can still be labeled as trans fat free. But do try to avoid any of these foods that have this in the ingredient list. And now moving on to the second one, the saturated fats. So you can think of the S here standing for solid. So solid fats like coconut oil, palm oil, mostly animal products. So dairy like cheese, whole milk yogurt, cream, as well as this is where your red meat comes into play as well. Now, the American Heart Association recommends that less than 6% of your total calories come from saturated fat per day. So on average, if you're having about a 2,000 calorie diet, that would come out to be less than 120 calories or about 13 grams of saturated fat or less. And it can be complicated trying to count this day to day. So again, just try to focus on replacing your saturated fats with unsaturated fats, which we'll talk about in the coming up slides, and try to limit full animal fat. So just for examples of the amount of saturated fat, so a serving of whole milk yogurt has about 5 grams of saturated fat. 1 string cheese, again, full fat is 3 grams of saturated fat. Just 1 tablespoon of coconut oil has almost 12 grams of saturated fat. A slice of Domino's pepperoni pizza, 3.5 grams. Of course, don't usually just eat 1 slice here. And then 4 ounces of a ribeye, so about your palm size, maybe a little bit bigger, of a steak would be almost your entire day's worth of saturated fat intake. And I calculated these from the Calorie King app. Now, what are some strategies that you can use to reduce your saturated fat? So try to select skinless poultry. So if you are getting chicken, try to take off the skin or select ones that don't come with any skin. And if you're getting ground poultry, try to look for at least 93% fat-free. Same thing if you're doing like a ground pork or ground beef. Try to include more seafood, at least 2 meals a week. So it's good for your brain, it's good for your heart. So examples include fish like salmon, tuna, trout, sardines. And try to include more plant-based proteins too. So you're not just eating animal products, since they do tend to be higher in saturated fat. You can include things like beans, lentils, soy-based products like tofu, edamame, and then try to look for leaner red meat options. So it can include the words loin, sirloin, round cuts. They tend to be leaner. Choice and select grades. They also tend to be cheaper than the prime. And try to trim off any visible fat, such as on your steak, and stick to about a 3-ounce cooked portion per meal, so about the size of a deck of cards. Because, even if it's considered leaner, if you're eating a very large portion, you're still going to get a larger amount of saturated fat intake. And if you are trying to choose dairy products such as milk or maybe yogurt that are good protein options, try to look for low-fat or non-fat ones. Now, types of unsaturated fats. So these are the ones that tend to be more liquid at room temperature, in contrast to the saturated fat we talked about tend to be more solid at room temperature. So again, trying to replace your saturated fats with these poly and mono unsaturated fats that include examples like salmon, vegetable oil, avocados itself, nuts and seeds, olive oil. So these are all good types of fats that you want to try and include more of. And again, having more unsaturated fat versus saturated fat can help to lower your overall cholesterol and improve your heart health. Now going into fiber. So fiber, there's 2 types here. We have the soluble fiber and the insoluble fiber. So the soluble fiber, you can think of like oatmeal texture. They attract water and turns into gel, helps to slow digestion. And most importantly here, you see it helps to lower your blood cholesterol or lower the bad cholesterol count. So we're also going to talk about types of foods that contain a good amount of fiber to help you lower your cholesterol. Now, the insoluble fiber, this is more like the roughage, or like you can think of like celery. So it is made of non-soluble cellulose, and it helps with your bowel movement and to prevent constipation. And for those of you who have diabetes, it actually also helps. Both types of fiber help to, they don't affect your blood sugar, and they can actually help control your blood sugar and insulin response. Now, the recommendation to help improve cholesterol is to have at least 5 to 10 grams of soluble fiber per day. So here are some examples of what may qualify. So in the morning, you may have a cup of cooked steel-cut oats, and maybe you cut up a small apple in there with the peel on it, and then add in 2 tablespoons of flax seeds, and that would give you almost 10 grams of soluble fiber. And another example here, we have barley. So maybe instead of rice for one of the meals, you have barley. Maybe you mix it into your rice for both of the meals. But a cup cooked total would give you almost 7 grams of soluble fiber. And our last example here, a cup of lentils in soup could give you over 5 grams of soluble fiber here. Now, another thing we'll talk about here is sodium. So this doesn't have as much to do with your cholesterol as more to do with your blood pressure. So in food, sodium can help to add flavor. It can act as a preservative, keep foods fresh for a longer time. It can act as a binder, stabilizer in your body, and it has some pretty important functions, such as helping to conduct nerve impulses, contract and relax your muscles, and maintain proper balance of fluid and minerals. Now, if you have too much sodium, then it can cause high blood pressure by holding in too much water, pushing through your blood vessels, and it can cause heart disease and stroke, as well as damage your heart, aorta, kidneys. It can affect your bone health and also increase your risk for stomach cancer. Now, the requirements for one day typically is about 500 milligrams. On average, though, the average American is intaking about over 3,400 milligrams a day of sodium. Now, the recommendation from the USDA is less than 2,300 milligrams, and from the American Heart Association is less than 1,500 milligrams in a day. So you can see the average intake is a lot higher than both their requirement and recommendations from these 2 groups. Now, where is all our sodium intake coming from? Well, a large percentage often comes from processed and prepared foods. So that can include frozen foods, snack foods, foods you get from the restaurant, takeout. Um, some amount is from natural sources, as in foods, some of the foods, even if you don't add any salt, it is going to have some natural sodium sources. And then another over 10% is added either while cooking or while eating too. Now here is a visual. So remember we talked about in the last slide, the general recommendation from American Heart Association is less than 1,500 milligrams of salt. So that would be less than 3/4 of a teaspoon per day if you were just talking about table salt. Whereas from the USDA, it's less than 2,300 milligrams, so less than a teaspoon per day of salt. Now, the sodium, it can come from different types of sources. So other than naturally occurring, you could find it in sodium chloride. So whether it's sea salt, table salt, or Himalayan pink salt, it could be sodium nitrate used as a preservative for lunch meats, sodium bicarbonate that we find in baking soda, baking powder, MSG, monosodium glutamate, and then sodium propionate, which is used as a preservative in bread. And here's an example to compare different types of foods and the amount of sodium. So we'll see here if you're having a chicken breast cooked, about 4 ounces, less than 100 milligrams of sodium. And compare that to your 1,500 milligrams to 2,300 milligrams in a day recommendation. Not a whole lot. Whereas if you have a chicken hot dog, so we'll count this as more processed, they've obviously added in a lot of sodium, you end up having over 600 milligrams of sodium in that one serving. And another example here, if you have egg noodles, just plain, you have a cup cooked, about 8 milligrams of sodium. Whereas if you have instant noodles, a lot of sodium in that sauce, in this soup packet, over 600 milligrams of sodium. Another good example here, cucumbers, just a fresh cucumber, no sodium. Whereas if you have a pickle, just 4 inches, because salt is the main preservative here, and ends up being almost over 1,000 milligrams. Another big one is soy sauce. 1 tablespoon has almost 1,000 milligrams as well. It's almost half of the USDA recommendation for one day. So try to keep these in mind as we talk about how to slow down on sodium. So do try to choose the fresh foods most often if you can. And I know the second bullet point, it says frozen meals, but in canned foods. But if you find frozen foods like frozen vegetables or fruit or canned fruits and vegetables that are low in sodium or no sodium is added, then that is perfectly fine. It's just as good as fresh foods. Try to limit canned and frozen meals that are high in sodium. And we'll talk about the label reading in a minute here, as well as dry packaged items. And try to limit cured, pickled, and smoked foods, as these also tend to be quite high in sodium, as we saw with the pickles in the last slide. And if you are cooking with sodium or salt, try to use only one ingredient. So if you already have soy sauce in that ingredient list, skip out on the table salt or the fish sauce, use it for a different recipe. And try to use herbs, spices, citrus, vinegars more often. You can also use things like Mrs. Dash or different types of herb spice combinations you can find at the grocery store. And if you're going out to eat, you can try to ask them to not put any salt in your food if they can, and that way you can control how much salt you're putting in yourself. Now going into label reading, so this will be important for when you're trying to choose out different products, and especially trying to limit the products you're buying that can be high in sodium. So the first thing you want to look at is always the serving size. So for example, this example here, our serving size is 1 cup. So you'll see that per serving, this is the amount of nutrients that you're getting, versus if you're having the whole container, so we'll assume the whole container maybe is 2 cups total then this is the amount of nutrients that you're going to be getting. Okay, so that's just my visual there for your 1 serving versus 2 servings of the food. And then what we talked about today to limit is the saturated fat, the sodium, and then another thing you do want to limit, especially with diabetes too, is the added sugars. Now you can think of the percent daily values as a cheat sheet. So if it's over 20% of the daily value, you can consider that high in that nutrient. So if it's over 20% saturated fat, try to limit that, as well as sodium and added sugars. Whereas if it's less than 5% on the daily value, that is considered low. So if you're looking for something low sodium, try to look for something that has less than 5% next to the daily value there for sodium. Another thing we talked about is fiber. So try to find foods or grains with at least 2 to 3 grams of fibers, 2 to 3 grams of fiber per serving. Keeping in mind that in a day, adults generally need around 25 to 35 grams of fiber in a day. All right, and the last thing I have here is an example of a recipe. So this was from the American Heart Association, and I just want to do a quick walkthrough of their website. Let's try this out. So if you look up the American Heart Association recipes, they have different categories of recipes, or you can look up something with a certain ingredient, maybe something with chicken or something with tofu that you want. But as an example, so this is edamame, so a soybean or soy product, a plant-based protein that we talked about. And you'll see that this one is a good amount of fiber, doesn't have any added sugars, and has a fair amount of protein too. It doesn't have a percent daily value, but remember, keeping in mind that you want less than 13 grams of saturated fat in a day. This one is pretty low, and it doesn't have too much sodium either. So what they used was, if you want that sweet flavor, they use a stevia liquid or packet, and then just some frozen shelled edamame. And again, try to look for low sodium on the package. And all you have to do is boil the edamame, put in that stevia in there, put in the edamame, and then mix it in the sauce here. So they use a little bit of soy sauce, sriracha, sesame oil, and then ginger and garlic and pepper, as well as vinegar. So a lot of these non-sodium ingredients here. And we have tried it, and it is pretty good. So we don't have we're unable to give you the recipe to try. But if you have time, try to make it at home or in any one of these recipes. And that is all I have for you today. So I think the main thing to summarize is that you want to try and replace your saturated fat intake with unsaturated fats. Try to increase your soluble fiber intake. So these two things can help to lower your LDL, your bad cholesterol, as well as avoiding trans fats and looking for that on your labels. And then try to be mindful and slow down on your sodium intake as well to manage your blood pressure.